Now it appears there is a surge in mentally ill patients roaming the streets of Nsukka, and this has become a major concern for residents and key stakeholders in the local government area of Enugu State. Elijah Akuma, Afia TV's correspondent, brings us more and would return with a conversation in just seconds. Don't go anywhere.
The visible increase in mentally ill individuals on Nsukka'S streets is undeniable, prompting deep concern among residents. Many report seeing unfamiliar faces appear suddenly, with some speculating they are discreetly dropped off at night by unknown persons. When Afia TV sought official clarification from the police regarding these claims and the overall situation, no comment was provided.
So when we talk about the causes of mental illness, myself, I can strongly say that it has, multi causes. I can say that some of them can be health related, and some of them mainly, I can assure you, are traditionally related. Because here in Nsukka, we have one of the beliefs that if you commit one or two atrocities in the community and someone, takes you to a particular oracle or deity, you have the chances of running mad. And when you watch the people that are already in the street running mad, they say that sometimes, like I said, it's gender based. We have the majority of them that are male. It's the locations you have few of them that are females. The majority of them are males and young males for that matter. To tell you that some of them might have been people that are already, maybe caused under the spell of some deities or maybe oracles as a result of their own wrongdoings in the society. And again, some of them might be as a result of medical issues. It can be as a result of depression. And some of them might be as a result of substance abuse.
Too much. Too much.
The question of what causes this growing mental health crisis in Nsukka evokes diverse theories among residents. While some point to hereditary factors, others deeply rooted in cultural beliefs attribute mental illness to transgressions against community gods or ancestral spirits. A significant number of respondents, however, believe the rampant abuse of hard substances, a growing concern among the youth, is a primary driver behind these tragic cases.
Because of this thing, it can cause by maybe we believe that genetically some people may have that kind of thing. Maybe after sometimes you see that some people in their lineage used to be mad. Yeah, one. But the major cause of it is all the smoking, I don't put in their hands, and the chorus as case may be. So the society, look at them. So many people have different perceptions based on how they are lived.
Amidst the despair, residents offer preventive strategies for tackling the mental health crisis. There's a strong consensus that reducing the intake of hard substances, especially among young people, is paramount. Furthermore, cultivating a moral lifestyle, avoiding mischievous acts, and promoting community support are believed to be essential steps in safeguarding mental well-being and reducing the number of individuals succumbing to mental health challenges.
Public awareness, because a lot of the youth out there, they no longer believe that some of these traditional, deities and oracles, they are still, effective until they run into the danger. So I think we need to kind of have a kind of orientation and grassroots, public awareness so that people will be able to be aware that wrongdoing is not really okay. It's not really good in the society. Robbing somebody, at the expense of the person's, consent is really bad. Doing a lot of atrocities and the rest of them is really bad because some of them have spiritual side effects. They're coming on the side of those ones that are medically attached. I think government should come into this. Because here I'm trying to beginning to see that not only in Nsukka, in a lot of states in across the nation, it's as if hard drugs is already legalized. Youth of nowadays, they go around in the streets, smoking in their hand, smoking all kind of, hard drugs without being checked. by the government. I think it's high time government started looking into this, bringing up a task force that should be looking into, incessant smoking.
This profound social challenge in Nsukka is a developing story that Afia TV remains committed to uncovering. We are still actively seeking the crucial viewpoints of the police, traditional leaders, and the voice of the church to complete this vital narrative. In Nsukka, Elijah Akuma, reporting for Afia TV.
All right, you are still watching the Afia Morning Show here on Afia TV, and of course, we just took that story from Elijah Akuma, Afia TV's correspondent, and it's important for authorities to take action to stem the tide of mentally ill patients, not just in Nsukka, but across Nigeria. Oji, what do you think is driving this surge in mental health issues in Nigeria?
Well, one, well, we can attribute it to the state of the nation. So many people are, doing a whole lot of thinking with their mindsets and all that, and it might go off because, when you're trying to hustle up and for ends mates and all that, and also thinking about maybe somebody's sick at home or so many wrong things going around the country and your family and all that. Then again, drug abuse is one attribute to abuse, because the way people consume hard drugs these days, when it gets so mad, like and sorry to say, it's more prevalent in women. It's sad, but it's more prevalent in women, because it begs me to ask this question. These are people who hold babies in their womb, consuming hard drugs and all that. Wouldn't this affect them in the nearest future?
Well, while I don't have the data to say that it's more prevalent in my gender, but
Do you know
that's
why
a gap work. I'm going to actually check it out and see the
said this?
statistics.
I have police friends. Pardon me to say, sometimes they do their stop and search. They keep complaining they get more drugs from women than men.
Yeah, I think it's the effect of peer pressure. Peer pressure is driving a lot of this increase in drug abuse, drug addiction, and the likes. But like I said, we'll get the data and of course find out if Oji is right. If it is prevalent more in women than the opposite gender, we'll find out about that, of course, as the week progresses.